If you want to keep using heroin, that's your business. If you want to stop using heroin, that's our business. Heroin Anonymous, Western New York. For more information, please visit our website at www.heroinanonymous585.org or call our 24-hour hotline to speak to a sober heroin addict at 585-348-8129.
Hi everybody, and welcome to this week's show of Rock and Recovery. My name's Carol Michelle, and today I am here with the one and only Stephanie Campbell. Thanks for being on the show, Stephanie.
Thanks for having me.
Okay, so everybody stay with us. We're going to be right back with a great show. Hi everybody, welcome back to Rock and Recovery. Today we're here with my friend Stephanie, and can you tell us what you do?
So I was asked last September, if I would be willing to join the Oasis team and run a project called the CHAMP Project, which is the Independence Ombudsman program, state ombudsman program that was set up by the legislature and the governor, thank you, Governor Cuomo, and the commissioner in 2018 to really address implementation of some of the access to healthcare benefits for mental health and addiction services that were needed in New York State. And it came from a lot of advocacy, and I think you know a little bit about my background before I came to Oasis to run the CHAMP Project. But a number of advocates around the state were identifying the fact that even though there were these extraordinary changes that were happening in the law, and I know that you interviewed recently Rob Kent, who's the general counsel at Oasis, who talked about having laws, but what happens when you can't enforce the laws, right? Mm-hmm. And so what we were seeing happen in New York State, and actually outside of New York State as well, is that despite the fact that there's been some real progress made in addressing some of the insurance barriers with in terms of legislation and regulation, mm-hmm. That still folks were having difficulty accessing those healthcare benefits, and they were in crisis. And so this project was funded through the governor and the legislature, and we kicked off on October 1st of 2018 to really help folks get access to care.
That's awesome. So this is brand new.
Mm-hmm.
Okay, so is there anything similar in other states, or is New York?
So this is really, and New York has been, I live here, so I'm a little biased, but I have had conversations on a national level with people who are looking at New York and saying, you guys are just, groundbreakers in terms of a number of issues, including, the changes to the insurance laws that have happened under Commissioner Arlene Gonzalez Sanchez, and of course Rob's been really spearheading that. And so the long answer to your question is there's nothing that's really of this magnitude that's out there. There are other ombudsman programs, and an ombudsman, the definition of an ombudsman, because I had to look it up myself, I didn't know what it was, is an enforcer, right? So so I oversee this project in which we have contracted out with the Community Services Society based in New York City to run a helpline, which is open 9 a.m. to 4 p.m. Folks can call either before 9 a.m. or after 4 p.m. To leave a message, and someone will get back to them the following day. Or they can send me an email, and I'll work to do what I can, at off hours and weekends to get them the care that they need. But essentially, there's a helpline in which an individual will call 888-614-5400, and they will be connected to someone who will take the call. And oftentimes, what we're finding is that folks will have a difficult time. They'll want to get into an inpatient SUD treatment facility, and they will, their insurance, they'll have issues with with insurance coverage. We've also had situations on the mental health side where someone will, need access to a certain kind of medication, for example, perhaps a long, term injectable medication that will help mitigate some of the the need to, the issues that come up for folks that, have some significant psychiatric issues that will prohibit them from being able to take medication on a daily basis. And so, so sometimes there's, issues around what's on the formulary, for example, of a medication. So we help folks access care. We help them with enrollment issues. We've had a number of cases in which an individual doesn't have health care insurance, period, and so they can't get access to care by virtue of the fact that they don't have insurance. And we'll help. We have navigators on site who can help get them enrolled. We also, on the substance use side, we have a number of ATCs, addiction treatment centers around the state that we will get folks into, and then worry about, they don't have to have insurance to do that, and we'll get them insurance at a later time. There's also, folks have questions in terms of, I'm looking at my plan and I don't know what it says, or this is very complicated. And insurance is incredibly complex. One of the lawyers on our team is a parity expert, and has been doing this for a decade. And and she said to me, it takes time to really understand the nuances. So of course you have a family member who's in the middle of a crisis with their loved one, trying to get them into mental health or substance use treatment, and they're in a situation where they have no idea what they've called the insurance company says you're not covered, and then what, right? And so so we're really trying to get folks access to care in the moment, or at least resolve their issues in terms of the barriers and obstacles that they're facing as quickly as possible.
That's great, and it's so needed. There's a lot of families that I speak to that say they're really having a hard time navigating the system, and like you said, insurance is so complicated. Why say in 5 words what you could say in 105 words, right? It's very, very wordy and complex and stuff. So what now, if somebody calls this line, say if they just, they want to get into treatment, they don't know where to go. I mean, what are the scope of the questions you can answer on the helpline?
So what we would do using the helpline is we would find out, where they are regionally. So the way that the project is set up is, we've contracted out it's a hub and spoke model. So the hub is the helpline, which is that 888-614-5400 number. And but then there are specialists. So there are 4 specialists that are partnering with us on this project. Legal Aid Society is one of them. Legal Action Center is another one. The Medicare Rights Center, and the New York State Council for Community Behavioral Health Care. And they're the count. We call them the council. The council is really specializes in mental health and substance use. They have decades in between. The folks that work on from that specialty, decades of clinical experience. But on the other, the other partners, so Medicare rights, oftentimes folks who have Medicare have considerable barriers to accessing addiction and mental health care. Mm-hmm. And so they are specialists in that area. A Legal Action Center has been for decades advocating on behalf of protecting the rights of individuals who have substance use disorder. And then, the Legal Aid Society also advocates for folks that are undocumented or, folks that have often been most marginalized. And so we have these 4 specialists who are able to provide technical assistance and help, with questions that come up around specific issues, and can help file appeals when they've been denied access to care, or really help provide some of the legal expertise. And then we have 5 CBOs, community-based organizations, that are also the spokes that come from the hub around the state, mm-hmm. or that feed into this partnership. And that includes, in this neck of the woods, Saving the Michaels of the World is one of the CBOs. There's the Adirondack Health Institute, AHI, in the northern part of the state. There is down in Staten Island, CHASI, the Community Health Association of Staten Island. There's the Cortland, the Family Association of Cortland, in the central New York part of the state, and I think I got all of them. There should be 5. Did I say 5?
I think so.
And then the Family Association of on Long Island, Children and Families Association of Long Island. They're down in Long Island, obviously. So there's a number of these community-based organizations that are based around the state that really understand the regional resources and are providing education and doing outreach and engagement with folks, and so they also have play a major role in the success of this project, and are helping folks. They're the boots on the ground. So we've been able to, as of yesterday, we've helped. We've opened 1,067 cases since this project started in October.
Wow!
And so that's less than a year, which is pretty exciting for us that we've been able to assist those folks, and and there's a number of again, different needs that are being addressed, including access to insurance benefits, care using insurance benefits, enrollment, addressing denials, appealing, getting folks information about their plans, et cetera, et cetera. So there's a wide range of services that CHAMP offers folks.
That's a lot of information, Stephanie. We're going to have to go to a break, but we'll be right back.
Okay.
Wow.
If you want to keep using heroin, that's your business. If you want to stop using heroin, that's our business. Heroin Anonymous, Western New York. For more information, please visit our website at www.heroinanonymous585.org or call our 24-hour hotline to speak to a sober heroin addict at 585-348-8129.
everybody, and welcome back to Rock and Recovery. I am here with Stephanie Campbell, and boy, you've given us so many things to think about. I do have a couple questions for you.
Okay.
We were talking about, if somebody has a problem with an insurance company, maybe you can help them to access information so they can start an appeal and all that stuff. What about like punitive measures against insurance companies? Is there anything like that that's going on? Because when somebody needs help, right? I mean, you can say, okay, we're going to fight the insurance company or whatever. That takes time, right? When somebody needs help today, what can somebody do if they're denied and it's like, uh-oh, now I'm stuck?
Well, that's the whole point, is that when we get someone who is having issues accessing care because of an insurance barrier, our team can help them have conversations with the plans to help navigate if there's a certain documentation that's needed. Perhaps they didn't understand what the insurance company needed in order to get them access to care, or maybe the folks who are denying them access, on the plan side, don't understand, the law, and so we can be helpful in helping them, understand that. But we also file appeals, and we work collectively to, if there's, if the folks that are on the helpline or the lawyers that are working on things really run into something, oftentimes, I'll get the call if someone needs, and I've had two this morning where someone, a family member is like, we don't have time to wait. Time is of the essence. Can you get us, into care? And, and I can work with my team to make that happen relatively quickly. So there's also other resources that we can help folks get into. Anytime Monday through Friday, we can get folks access to treatment. On the weekends, it can be a little more challenging because, unfortunately, the way that the treatment center, traditional treatment center, has been set up is that admission is between 9 and 4 Monday through Friday. But there's some incredible, and this goes back to your question about is there anything like what New York State has going on in other states? And I would say that some of the more innovative programs, like the Cody Project, in which we've got mobile units, and we've got peers that are now being that are available across the state. We have the 24/7 open access centers, so we can usually help folks navigate very, very quickly. At least on the substance use side, and we're building that capacity on the mental health side as well. So there are ways in which we're able to get folks in. Again, we recognize that time is of the essence, and so that's what we're committed to doing.
I am so glad that you are in this position, because I know that you understand the urgency that families feel and that people feel when they want recovery. It's like, but it's got to be now, right? Every minute counts.
Every minute counts.
And I love that you understand that, and you could be compassionate with families that are going through that and feeling all that anxiety and stuff. So that's fantastic. What makes you so passionate about this issue, do you think, Stephanie?
I've been given the gift of recovery. I came into recovery, and I was just speaking at a meeting this morning, a recovery meeting early this morning that I attended, and I've talked about this and shared my story in former roles that I've had, but I came into recovery in 1989 initially, and I was a homeless street kid, and had no family. The recovery community became my family, and they literally built me from the ground up. And I got community and connection, which we know is at the essence of what people need to recover. You know, we need to break out of the isolation. And by the way, it's not just the individuals with the illness themselves, but the families, the shame that's been perpetrated on families who have a loved one who's sick and suffering. And so I know firsthand what that's like. And you know, and then I'm also a mother of a child who you know, overdosed in 2015. And with all of the knowledge that I had in my own experience, when it came time to getting her access to care, it was I had been hit by an avalanche. And you know, because of the kindness of other family members in recovery, and you know, the connections that I had in the recovery movement, I was able to get her into care on a couple of separate occasions. This illness is chronic. It's treatable. It is, you know, there are ways to prevent, you know, access to addiction and you know, and mental health care, social determinants of health, that, you know, issues that hopefully as a society we're going to address more. But the reality is, it's fatal oftentimes if not treated. And there are multiple pathways to that treatment, but we have to really, the compassion that was shown to me and that I've seen on a daily basis, you know, among peers and family members, and you know, and now really sensitized providers who are understanding you know, the true nature of this illness, that it's not a choice, it's not a moral issue. You know, we can't just tell someone, you know, try harder, you know, or call family members enablers if they're kind and compassionate to their loved ones and they keep trying, you know, grasping for, you know, any which way to keep their loved one alive. You know, those are all, it takes a village, and it takes a community to really create that support. So that's, you know, what drives me personally, what drives me professionally. I'm also clinically trained, and you know, and I ran a state organization that you know, was really is a major player in you know, partnering with the state to get to build advocacy, you know, from the grassroots in terms of policy, and then, you know, the effectiveness of that union is really what's driving and what's made you know, New York State you know, a national leader in terms of you know, how we're addressing this epidemic. And the fact that we have a governor who really understands and appreciates the nature of this and is willing to put resources into it, and the legislature, you know, on both you know, sides of the aisle that are working in a bipartisan manner to you know, to get funding to, you know, to support these you know, valuable projects is incredible. And then of course we have advocates like you, like Carly, like you know, hundreds and hundreds of advocates that I've met across the state, who give of their time and resources and energy and volunteer and you know, raise their voices and stand up and speak out and demonstrate the power and promise that we do recover, right? If we're given the care that we need, we go on to have extraordinary lives, you know. So that's my commitment, and I'm honored on a daily basis to have the opportunity to do this work.
And that's why I like you so much. Look at you. That's fantastic. So I heard you say a couple times, you said you referred to grassroots, you referred to boots on the ground, and I think it's really important to do that, and I love that. That's important to you as well, to know what's going on in the local community, because you can't, there's no cookie cutter way, and there's no cookie cutter community. Things are a little bit different no matter where you go. And being able to understand what the local resources are, like what's available right here in Monroe County, as compared to somewhere in New York City. Totally different ball of tea, right?
Yeah.
Ball of tea. I don't think that's a saying. But
Ball of
yeah,
wax.
ball of wax. Cup of tea, ball of wax, something like that.
Yeah.
Yeah, so that's really cool. Okay, so we're going to go to a break, but we'll be right back.
He's doing a good job.
If you want to keep using heroin, that's your business. If you want to stop using heroin, that's our business. Heroin Anonymous, Western New York. For more information, please visit our website at www.heroinanonymous585.org or call our 24-hour hotline to speak to a sober heroin addict at 585-348-8129.
Hi, everybody. My name is Carol Michelle Halsizer. I am Executive Director of Mission Recovery and Hope. The drug crisis has impacted our community. There were over 1,100 overdoses reported by the Sheriff's Department in 2018. Many families in our community are sitting across from an empty chair at the dinner table. If you need help, or if you have a loved one that needs help, please contact us. Our phone number is 585-944-4270.